Hello, everyone. Hi, Dr. Hatta here again. With me is Dr. Cheong Yee Tsing, a fertility specialist from SabahCare Fertility Centre. And today, we would like to talk about endometriosis, which is a very common condition in the female gynecological pathology. So, without further ado, hi, Dr. Cheong.
Hello, hi everyone.
Uh, can you tell us a bit what is endometriosis?
Yes, endometriosis is a condition where the inner lining tissue of the uterus grows outside the uterus. So here there's a simple model. I hope you can see. Let's start with the anatomy of the female reproductive tract. This is the uterus. We have two fallopian tubes and two ovaries. So the inner lining tissue escapes and grows outside the uterus, and it can involve the tissue lining the pelvic cavity. It can involve the tube, the ovaries, and practically any organs that is in the pelvic cavity, including the bowel. Let us show you in a diagram form how it looks like. So in the diagram form, and the tissue that grows outside the uterus will appear like black spots. So you can see black spots on the part that is involved. And this condition typically causes pain. It can be painful periods, painful sex, painful urination, and painful when you open your bowel. And why is it so? Because when we have a period, actually it's the shedding and bleeding of the inner lining tissue that forms the menstrual blood. Because the endometriotic spots outside the uterus is similar to the inner lining tissue, so they too will bleed during period. So over a period of time, when the repeated bleeding happens, is going to form scar tissue and adhesions. Adhesion means the pelvic organs all stick to one another. And how do we diagnose it? We
Yes,
can
how do you diagnose it?
we can perform a laparoscopy or keyhole surgery where we insert the camera into the pelvic cavity. If we can diagnose endometriotic spores and adhesion like this, then it can help to confirm the diagnosis. Even though laparoscopy is a minor surgery, but it is still invasive. So as far as possible, we try to reach the diagnosis by history taking, pelvic examination, and transvaginal ultrasound scan. And how can transvaginal ultrasound scan helps? Because when there is involvement of the ovary, normally it will form a cyst, which is actually the blood collection in the ovary, and we call it an endometriotic cyst or chocolate cyst. Please don't be mistaken. Chocolate cyst is not caused by eating too much chocolate. It's because
Okay.
the contents of the cyst is old blood, so it's dark brown in color and looks like chocolate sauce. And now with the excellent images we can get from transvaginal ultrasound scan, we can easily detect the presence of endometriotic cyst or chocolate cyst, and it can help to confirm the diagnosis. So as far as possible, we try to reach the diagnosis without having to perform the surgery. And yes, we do see endometriosis quite a lot among our infertility patients. Maybe Dr. Hatta can enlighten us on how it causes infertility and how to help these women to get pregnant. Over to you, Dr. Hatta.
Yes, thank you, Dr. Chong. Yes, we do see a lot of patients with endometriosis, and they have associated infertility problem. Um, the actual cause of infertility in patients with endometriosis is still unknown. However, we found that from studies that patients with endometriosis, the quality of their eggs are lesser. They're lesser than compared to those of the same age but without endometriosis. So this may cause difficulty for them to achieve pregnancy. Also, Dr. Cheong mentioned about adhesions or scarring. And sometimes this adhesions or scarring can lead to blockage of the fallopian tube. And as we know, fallopian tube is important for meeting of the sperm and the egg. So blockages of the fallopian tubes may be one of the causes of them to have difficulty to get pregnant. And also sometimes a patient who has endometriotic cyst may undergo previous operation to remove the cyst. And this, the only problem with this kind of operation sometimes is that it may decrease the ovarian reserve of the existing ovarian tissue. So this will, in addition, it will cause the quantity of eggs will be lesser. Therefore, it's difficult for them to attain pregnancy with a low reserve of eggs. But rest assured that we can definitely try to help those who are trying to conceive by certain procedures like IVF or IUI. IUI can be done if your tubes are not blocked, if your sperm is okay, and you don't have a big, you don't have an endometriotic cyst or any cyst at all. We can try to help you with the IUI. But otherwise, IVF is another viable option, which is equally or much better than IUI. And IVF in a patient with endometriosis, provided that ovarian reserve is still good, can increase your chance of pregnancy as opposed to normal sexual intercourse itself. Okay, so do you have any questions, Dr. Cheong? Anything you want to add to my talk?
Yeah, I think as for any other fertility problems, we always encourage early presentation. So especially for someone who have painful periods and you can't get pregnant easily, we advise to come forward earlier, just in case you do have endometriosis. So it is good to start treatment before the disease gets more advanced. So it's always good to do it when your pregnancy chances are good. So that's the advice I will give to my patients.
Yes, thank you very much. Okay, with that, I think we close our session for today. Do join us next time where we will be discussing about other pathology. And we plan to be talking about fibroids next time. So thank you very much, Dr. Cheong. Thank you very much, everyone, for listening and watching. See you soon. Bye.
Bye. Take care.